Good morning, everybody. Are you able to hear me? Hope you're able to hear me. Today's class is development of female genital tract. So why do we need to know about the development of female genital tract? Because there can be anomalies in the development of female genital tract, and these anomalies are seen in 1 to 2% of the females. So most of the anomalies go unnoticed because they do not have a significant effect, but some of those anomalies may cause menstrual disturbances as well as obstetric complications. The most common obstetric complications caused due to these Mullerian anomalies are recurrent abortions, preterm deliveries, and malpresentations. And the menstrual abnormalities may be due to the imperforate hymen, hematocarpose, and all. So the development of female genital tract is described under 3 subdivisions. Those are the development of gonads, development of female external genitalia, and the development of female internal genitalia. So first coming to development of gonads. The genetic sex, that is the XX or the XY, these chromosomes decide the gonadal sex. If there is Y chromosome, then it develops testes. The fetus develops testes. If there is no Y chromosome, then they develop into ovaries. So the most responsible chromosome is the Y chromosome, and the gene responsible for this is the SRY gene that is present on the short arm of Y chromosome. So it is the presence or absence of this Y chromosome, it decides the gonadal development in the fetus. So until 6 weeks of intrauterine life, the fetus is sexually undifferentiated and it has got bipotential gonads. So if the Y chromosome is present, then the genital ridge that is going to develop into testes. If there is no Y chromosome as seen in XX, the genital ridge develops into ovaries. If the genital ridge develops into testes, then there should be external genitalia particular to male. So in the testes, there are 2 kinds of cells. Those are the Sertoli cells and the interstitial cells of Leydig. Sertoli cells secrete a hormone called AMH. AMH is anti-Mullerian hormone. This anti-Mullerian hormone, the name itself says anti-Mullerian, against the Mullerian development. So this inhibits the development of uterus, fallopian tube, cervix, and the upper vagina. So then the Leydig cells. Leydig cells are the cells which produce testosterone, and with the action of 5-alpha reductase, this testosterone gets converted into dihydrotestosterone. This further stimulates the development of male external genitalia. Dihydrotestosterone is the hormone that is responsible for the development of male external genitalia. When there is no Y chromosome as seen in XX, that means the female, the genital ridge is going to develop into ovaries. As there are no Sertoli cells, there will be no AMH. So the uterus, fallopian tubes, so no anti-Mullerian hormone. That means the Mullerian development will be continued. And there are no Leydig cells, so there is no testosterone and no dihydrotestosterone. So it will develop into vagina and lower part of vagina, and female external genitalia will be developed. As seen here, it is the pictorial representation of what I've already told. It is the presence of the Mullerian inhibiting factor of the anti-Mullerian hormone that causes the regression of Mullerian ducts. And the testosterone, which further develops the seminal vesicles, vas deferens, epididymis of the testis. And the dihydrotestosterone forms the leads to the formation of external genitalia, that is the pineal development, the scrotal folds, and the prostate. So as there is no anti-Mullerian hormone or Mullerian inhibiting factor, there will be differentiation of fallopian tubes, uterus, upper 1/3 of vagina. And as there is no testosterone, there will be regression of Wolffian ducts. Before going into the topic proper, I would like all of you to know about this Wolffian duct and the Mullerian duct. So it is the most confusing part, like Wolffian duct, Mullerian duct, and paramesonephric duct, mesonephric duct. These four words are used throughout your chapter of, anomalies of the uterus. So the Mullerian duct, it is also known as paramesonephric duct. If you have got notes, write it down. Mullerian duct is also called as paramesonephric duct, and the Wolffian duct is also known as mesonephric duct. This Mullerian duct is the main genital duct in females, and the Wolffian duct is the main genital duct in males. So what happens in females is there will be development of Mullerian or the paramesonephric duct, and there will be regression of the Wolffian or the mesonephric duct. These four words are very confusing even during your entrance exam. So now it is known that the ovaries develop from the genital ridge. This genital ridge, it extends from the, this genital ridge extends from the pronephric region. That means where the future kidney will be present, pronephric region above to the sacral region below, and it is represented as a long elongated vertical eminence on either side. Then the mesoovarium is developed by means of which it is attached to the intermediate cell mass. So from the upper part of the ovary, there arises the infundibulopelvic ligament, which connects the ovary to the lateral pelvic wall. And this is the ligament of ovary. This ligament of ovary, after the complete development, see, you are able to see the ovary here, but after the complete development, it descends into the pelvis. It is at the pronephric region. So after the development, this ligament of ovary, the proximal attachment of the ligament of ovary becomes the ovarian ligament, and the distal attachment, see, this is the distal attachment. This distal attachment becomes the round ligament of uterus. Round ligament of uterus, which is homologous to gubernaculum of testis in males. Okay. So the ovaries are developed from the 6th week till the 12th week. The ovaries are developed, and there will be, as I told you here, there will be descent of ovaries. Initially they develop in the lumbar region, and at birth they are present at the pelvic brim, and even after birth, by puberty, that means from birth to puberty, there will be migration of these ovaries from the lumbar region to the pelvic region and into the pelvis. So, okay, ovary has developed, then where do the germ cells come from? What are the germ cells? They are the oogonial cells. So, germ cells, these germ cells are called the primordial germ cells. They arise from the yolk sac. See, during the development, this is the yolk sac. These primordial germ cells arise from the yolk sac. From the yolk sac, they migrate along the mesentery. So here, from the yolk sac, they migrate along the dorsal mesentery of the hind gut. This is the gut. So this is the hind gut. Okay, this is the gut here. This is the hind gut. This is the cloaca part. So the cloaca part is also important for the development of external genitalia. So hind gut, along the dorsal mesentery of the hind gut, they reach the genital ridge. See, the genital ridge is present on either side, and these yolk sac cells, they migrate along the dorsal mesentery. Why I'm stressing on the dorsal mesentery of the hind gut is that this point will be asked as an entrance question into the genital ridge by the end of 4th week itself. At first, there will be stromal development, that is the sex cords are developed. These primordial germ cells, they are migrating from the yolk sac to the genital ridge, and there will be primary sex cord development. That means the stroma and the cells in the mesothelium, they develop into the primary sex cords. These primordial germ cells, they arrange them into the primary sex cords. And then these primary sex cords are arranged in columns perpendicular to the surface deeply in the substance of genital ridge by sixth week itself, and they are known as primary sex cords. And the secondary cords develop at a later date near the epithelium, like you've seen here. This is the secondary sex cords. They develop, these are the secondary sex cords. They develop at a later date than the primary cords. Both these cords are derived from the local stroma, as I have already told you. The migrated germ cells are identified. So how do you differentiate between the sex cord stromal cells and the germ cells? So these sex cord stromal cells are differentiated from the migrating germinal cells by microscopic features. That means the migrated germ cells are larger in size, and also they're having the electron microscopic feature is that they're having a peculiar mitochondria. Okay. And why we have represented rectum and urinary bladder when we are discussing about the development of genital system is that urogenital system develops simultaneously, and any anomalies in the genital system can have some anomalies in the urinary system also. Sorry. Where are we? Yeah. The germ cells undergo rapid division to form oogonia. Those are the primordial follicles. By 20 weeks, there are maximum in number equal to 7 million. These primordial germ cells, that means the primordial follicles, they enter the first meiotic division and are arrested in the prophase. Then becomes the, when they enter into the first meiotic division, they become the primary oocytes. Then they are arrested in the prophase. That means prophase of first meiotic division. And when do they complete this meiotic division is that at the time of fertilization only, they'll become the secondary oocytes. At birth, there are 7 million at 20 weeks, and at birth, their number is about 2 million. And there is a process of attrition called attrition, and of these, only 300 to 400 will ever ovulate during the reproductive period of a female. That means from 12 years, like 12 to 13 years of age, to like 45 to 50 years of age, that is the reproductive age, and there will be ovulation in this period, and there are only 300 to 400 only ovulate, and the others will become the atretic follicles. This is about the gonadal development. So coming to the development of uterus, fallopian tube, cervix, and the upper two-thirds of vagina. Because vagina has a dual origin. Vagina develops from the Mullerian duct as well as from the urogenital sinus. That means the vagina has got a dual origin, and some of the books will say upper two-thirds and lower one-third. Some books will say upper 3/5 and lower 2/5. In your book, it is given as upper one-third, but upper two-thirds and lower one-third. You just remember it like that. So the normal for the Mullerian duct development in the Mullerian system, the development is divided into 3 phases. That is the phase of organogenesis, the phase of fusion, and then the septal resorption. why I'm stressing on this is the development of the Mullerian system and the anomalies. They are going to appear for your entrance exam. They are going to have, they're going to give many questions. Like, it'll be like when we are seeing this, when we are reading this, we'll think that we know everything. But when you go for the exam, we feel that it's most confusing part. So I have given you many pictures to make you understand it completely. So here, when you see, these are the two Mullerian ducts on either side. See, these are the gonads, that is the ovaries. Here we'll discuss only the female genital system, so the gonads are the ovaries. So this is the Mullerian duct. This is organogenesis. Organogenesis is first the formation. So the Mullerian duct formation is called is this, and then occurs the ductal fusion. So here from the middle part, the ducts have fused to become one. And when there is fusion, there are two separate walls of these two ducts, right? So the next phase is that the septal resorption. In some of the cases, this resorption will not be proper, so there can be complete uterine didelphys or an arcuate uterus if it is like up to here, or a septate uterus of the septum persists, or a subseptate uterus when the septum is up to here. Okay. So from the 6th week, the ovaries start developing. But in the 7th week of intrauterine life, an invagination of coelomic epithelium occurs close to the primitive gonads. See, here, it is close to the primitive gonad. So in the 7th week of intrauterine life, an invagination of coelomic epithelium occurs close to the primitive gonads in the upper lateral portion of the intermediate cell mass called as the Mullerian duct or the paramesonephric duct on either side. Why it is called paramesonephric duct? Because it is on either side of the mesonephric duct or the Ulfian duct, which undergoes huge further regression in a female. So, see, these two ducts, they develop laterally, lateral to the gonads, but they as the two ducts develop and grow caudally, they cross the Ulfian duct and fuse in the midline. See, they have crossed the Ulfian duct. They've crossed the Ulfian duct and they have met in the midline. So the cranial free part, here it is there, the free part, cranial free part, this forms the fallopian tube. The middle fused part, the middle fused part forms the uterus and the cervix, and the distal fused part, see, the uterus and the cervix are formed till here, and the distal fused part, this give rise to vagina, upper part of upper 2/3 of vagina. See, the same is represented here. This is the genital ridge. This is the mesonephric duct or the Ulfian duct. And here develops the invagination of the coelomic epithelium will give rise to the paramesonephric or the Mullerian duct. So, and here you can see during the development, there will be descent of the gonads. And here you'll be able to pursue the involuting mesonephric duct. Here there is fusion. This part becomes the uterus, not undergoes septal resorption. This is the urogenital sinus and the sinovaginal bulbs coming from there. I'll deal it about it in the next slide. And then this regressed mesonephric duct will form the epiphoron, paraophoron, and the Gardner's duct. This vestigial paraophoron, epiphoron, and the Gardner's duct. So how is the muscle mass developed? The muscle mass of the uterus is differentiated from the surrounding mesoblastic tissues. The circular layer is formed by the fifth month, circular layer of mother. You know that uterus has got circular layer, longitudinal layer, and the longitudinal layer is developed by the seventh month, and the cervical glands, they are developed in the sixth month, and you'll be able to see the cervical glands in the sixth month. And the mature glands of body of uterus are seen from ninth month. There may be primitive glands in the uterus from the initial development stage itself, but the mature glands of body of uterus are seen from ninth month. Then comes the development of vagina. So when you're reading about the development of vagina, you'll come across various terms like primitive cloaca, urogenital sinus, sinovaginal bulbs, urorectal septum, and all. I wanted to make sure you know it in the class itself. So the primitive cloaca is divided by the formation of urorectal septum. It is the urorectal septum. Wait, I'll show you. Yeah, urorectal septum into the ventral urogenital sinus and the dorsal rectum. The primitive cloaca. I'm stressing on this because it will be confusing when you go through the book. Primitive cloaca is divided by the formation of this urorectal septum. What is this urorectal septum? It is further developed into the perineal body. This perineal body, you know it very well, it will be covered in your obstetrics. It is the most important part and it should not be cut during the episiotomy. That's why we give a lateral episiotomy. A midline episiotomy is not given because it injures the perineal body. This urorectal septum, which is formed to divide the primitive cloaca, gives rise to the perineal body in future. And this ventral part gives rise to urogenital sinus. From this urogenital sinus, the lower vagina develops, and also the external genitalia develop from this cloaca urogenital sinus, and the dorsal part is that of rectum. So, okay, the Mullerian ducts have fused, and the fused caudal end is going to form. The fused caudal end is going to form the vagina, upper part of vagina. So, where does this lower ends of Mullerian duct terminate? They terminate on the posterior part of the urogenital sinus. When you consider it as a box, when the urogenital sinus is considered as a box, then the Mullerian ducts terminate at the posterior part of the urogenital sinus as a solid Mullerian tubercle. It is called as solid because it is not canalicalized. And there will be development of sinovaginal bulbs from the urogenital sinus. These sinovaginal bulbs are part of urogenital sinus itself. This will be asked as an entrance question. This urogenital sinus, it will have its endodermal evaginations. Two endodermal evaginations come out from the urogenital sinus at the posterior aspect where the Mullerian duct has fused with the urogenital sinus. These are the solid sinovaginal bulbs, bilateral sinovaginal bulbs. These are called as sinovaginal bulbs. They fuse to form with the solid Mullerian tubercle. The lower ends of the Mullerian duct, which are terminated in the posterior part of urogenital sinus, are called as solid Mullerian tubercle, and this solid Mullerian tubercle gets fused with these bilateral sinovaginal bulbs to form the vaginal plate. There will be subsequent canalization of this vaginal plate, followed by, after the canalization, there should be epithelialization. So, subsequent canalization of the vaginal plate, followed by subsequent epithelialization with cells from the urogenital sinus forms the vagina. Why it is specifically mentioned like epithelialization with cells from the urogenital sinus? Because the vaginal plate, the complete vaginal plate will have the epithelium from the urogenital sinus. So it is endodermal in origin, not mesoderm. See here it is represented. There, it is not that after the septal resorption it gets connected to the urogenital sinus. They will be developing simultaneously. So the uterine tubes, the utral septal resorption and the fusion with the urogenital sinus, they will all take place simultaneously. So here the tip of the Mullerian duct which forms the Mullerian tubercle, it gets fused with the sinovaginal bulbs. Sinovaginal bulbs, these are the bilateral sinovaginal bulbs that are formed from the urogenital sinus, which forms the vaginal plate. This fuses with the Mullerian tubercle and forms the vaginal plate, which undergoes subsequent canalization followed by epithelialization. And there is a structure called as hymen. What is this hymen? Hymen is the embryological septum between the sinovaginal bulb's elbow and the urogenital sinus below. See here, the sinovaginal bulbs will be developing from the urogenital sinus. This is all the urogenital sinus, and this gives rise to the sinovaginal bulbs as well as the urinary bladder. So, a urethra and the bladder. This sinovaginal bulbs and this portion is called as the hymen. See here, you will be able to appreciate that the vagina is get opened into the urogenital sinus. See, it is the hymen. So it is the embryological septum between the sinovaginal bulb's elbow and the urogenital sinus below. Next comes the development of external genitalia. As it is already said, urorectal septum, which forms the future perineal body, divides the cloaca into two parts. That is, we have already seen the ventral urogenital sinus and the door. Divides the cloaca into two parts like dorsal rectum and the ventral urogenital sinus. This urorectal septum originally, see, here it is the cloaca part. This is the cloaca part seen from below. This is the urorectal septum. Urorectal septum originally consists of two folds, one on either side. See here, one on either side. It develops and gets fused in the midline and thus forming midline caudally, thus forming a rectum and the anal canal and thus dividing the cloaca into a urogenital sinus and the rectum. So here what happens is the clitoris is the genital tubercle. This clitoris develops from the genital tubercle at about 5th week of intrauterine life. As I already told, these are simultaneously developing in the female fetus. That means the genital ridge development, then the gonadal ducts development, the external female genitalia, they all develop simultaneously. So the clitoris develops from the genital tubercle at about 5th week of intrauterine life. From the region of genital tubercle, a genital fold, these words are very, very important. Genital fold passes backwards lateral to the urogenital sinus to form the labia majora. See, This is the genital fold, or it is also called as genital swellings. They develop on either side of the clitoris and they develop continue. They continue with each other. That forms the labia majora. Between the genital folds or the genital swellings lies the anterior part of the cloaca membrane, which breaks down to form the labia minora by sixth week. See, these these become the labia minora. The cloaca, it gets ruptured. The aperture, uh, which breaks to form the labia minora inside the labia majora. And the vestibule and urethra are derived from the anterior, as I have already told you, the urethra will develop from the urogenital sinus. So the vestibule is that the where the urethra the opens into. The vestibule is developed from the anterior part of the urogenital sinus, because we have already studied that the Mullerian ducts infused with the posterior part of the urogenital sinus. And then the Bartholin's glands and the Skene's glands are derived from down growths of urogenital sinus. These are the glands that are seen in the vagina that derive from the urogenital sinus. This Bartholin's gland, it is present in the labia majora. The external genitalia are recognizable by the 12th week of intrauterine life. So, and by 16th week, it is clearly visible by ultrasound. Here, there this table is from your book, Shaw. It is the structural homologs in male and female, and you must know this. The concept of structural homologs is very important in your entrance point of view, because I have already told you the germ cells. These are the cells that are just brushing up with your with what I have already told you. Germ cells, we have told that these are the oogonial cells, and the determining factor is the XY or XX, and the SRY gene present on the short arm of Y chromosome is the determining factor. So unless there is a Y chromosome, all the fetuses will be destined to develop into female. If there is Y chromosome only, the testis will act upon, and then the anti-Mullerian hormone will be present. The testis differentiating factor will be present for the differentiation of the testis. So the germ cells, the homolog, ogonial homologs are the spermatozoa. The coelomic epithelium, which forms this further development of spermatozoa as the Sertoli cells. Here it is the granulosa cells which surround the oogonia. These granulosa cells, they are arranged along, surrounding the primordial follicles. And then the mesenchyme, that is the Leydig cells in the male, and there are theca cells in the female. Theca externa, theca interna around the secondary follicle, the Graafian follicle. Is that these are these are like Leydig cells. These Leydig cells are also the nourishing cells in the male. So as these theca cells. And then coming to ducts, I already told you this paramesonephric duct is also called as the Mullerian duct, and the mesonephric duct is also called as the Wolffian duct. This paramesonephric duct or Mullerian duct, it is not of any significance in male, and it forms the hydatid of testis. In the female, see the sequence. In female, it forms the fallopian tubes, the uterus, the upper 3/4 of vagina, because of the absence of Y chromosome. If there is a Y chromosome, that will be testosterone and the Mullerian inhibiting factor forming the mesonephric duct or the Wolffian duct, which forms the vas deferens, seminal vesicles, and epididymis. As I have already told you, this Wolffian duct or the paramesonephric duct, it undergoes regression in female, forming epophoron, parophoron, and the Gartner's duct. And coming to the external genitalia, the urogenital sinus, it develops the female lower part of vagina, the Skene's glands and the Bartholin's glands. And in the male, there will be development of glands, prostate and the Cowper's glands. So I have already told you that the Leydig cells secrete testosterone, and this testosterone, by the action of 5-alpha reductase, gets converted into dihydrotestosterone. This testosterone, dihydrotestosterone, are responsible for the development of male external genitalia. As there is no Y chromosome, there will not be any testosterone or dihydrotestosterone, and there will not be the male external genitalial development, and it will be female external genitalial development. See the genital tubercle. What I have told you is the Mullerian tubercle is different from the genital tubercle. Mullerian tubercle is that the fused caudal part which fuses with the sinovaginal bulbs coming from the urogenital sinus forms the Mullerian tubercle. Here it is in the external genitalia, it is the genital tubercle which forms the penis in males, and the homologous part of penis in males is the clitoris. Then I have told you about the genital folds. These are also called as genital swellings. Genital swellings in male forms the scrotum, and as it was discussed, they form the labia majora. It is an important entrance question because like there are urogenital folds here, genital folds here. They want to confuse you and they'll give like what are the urogenital folds identical to, like genital folds are further develop into, and what is the home in from this table itself you can expect an MCQ. So the scrotum, what is the part that is present in female which is homologous to scrotum in males? They'll ask you like that, and they'll give you labia minora and majora. So it will be a little bit confusing, but genital folds or the genital swellings. In some books, it is given as genital swellings. These genital swellings give rise to labia majora in female and scrotum in males. What happens to the urogenital sinus? This urogenital sinus further develops into bladder, urethra, prostate, bulbourethral glands in male, and in the female, from the urogenital sinus arise the sinovaginal bulbs which form the lower portion of the lower portion of vagina, the Bartholin's gland, the paraurethral glands, urinary bladder and urethra. That's it. Thank you. If you have any doubts, please let me know. Okay, thank you.